questions that we get asked by our patients. Today we have with us Dr. Narayan Hulse, Director of Orthopedics and Joint Replacement Surgery at Fortis Hospital, Banarghatta Road. Dr. Hulse has over 20 years of experience covering an entire spectrum of orthopedics through his clinical work and training in well-known hospitals across 3 countries. Dr. Hulse has performed over 4,000 successful joint replacement surgeries and has also authored a book on joint replacement for patient education. Today, Dr. Hulse is going to enlighten us regarding the myths and facts of joint replacement surgery. Over to you, Dr. Hulse.
Thank you. Hi everybody. Joint replacement surgery is one of the most commonly performed surgery all across the globe. It is done in millions of patients over last 25-30 years all over the world in different countries in different numbers. And this operation is also becoming very popular in our country as well, including hundreds of these joints are done in many hospitals all over the country. I'm sure you have a lot of doubts and misunderstanding about this operation. And you may have a lot of doubts about how good these operations are, what are the complications. That's why we have organized this program today to directly answer most of these questions directly to you through this program. Thanks for the organizers for conducting this program today. First question is, what is a joint replacement? Actually, the joint replacement started about 50 years ago when the joint was completely destroyed, that was replaced with some non-living objects, for example metal or plastic like materials. The main thing is these metals or plastic, they don't have sensation. That's why when you replace the joint with these metals and other objects, you don't have pain. So for example, in the knee joint, the thigh bone and the leg bone are rubbing at each other. And because of this rubbing, you have pain, difficulty in walking, etc. When you replace it, the thigh bone and the leg bone both have artificial metal cap. And when you are walking after the knee replacement, for example, you walk on this metal cap. And the metal cap, because has no sensation, you will not get pain. Similarly, you have joint replacements for multiple joints. For example, you have a knee replacement, hip replacement, shoulder replacement, and elbow replacement and ankle replacements as well. There are even the small joint replacements for the fingers and the thumb and the other joints. The main thing is you will get a painless mobility after the joint replacement surgery. When you know that what is joint replacement surgery, let us try to understand who really needs these joint replacement surgeries. For example, somebody has some pain in some parts of the body, they cannot be dealt with by a knee replacement or a hip replacement surgery. There are very specific indications when you should do these procedures. In simple words, the joint replacements are done in those patients, especially who are elderly. With age, they have more problems and more pain. So those patients who have joint problems, for example, knee problem or a hip problem, which is coming in the way of activities of daily life. For example, you have pain coming in the way of your walk, climbing stairs, in fact, sleep disturbed by the pain, or you are taking too many painkillers. In those situations, when the joint is so much destroyed, or in medical word we call that as an end stage joint disease, that is when you will have to have a joint replacement surgery. So not everybody who have pain need not have a joint replacement surgery. Joint replacement is done in very small number of patients who have joint condition which is causing a lot of pain and it cannot be controlled with other medications, physiotherapy, etc. Maybe about 2 to 3% of patients who have arthritis, for example, who have joint pain will need a joint replacement surgery. So the next question, whenever you have been advised with an operation, is it how good these joint replacements are? You might have heard from your neighbor or a friend that these operations are not good or these operations are fantastic. It's very difficult for a patient to decide whether he should undergo an operation or not. Just remember a few points. these operations are not new operations. They have been done in millions of people every year since about 3 or 4 decades, and most of these patients have been followed up in lot of countries like Norway, Switzerland, UK, Canada, Australia and US, with their results over a period of like 3 or 4 decades, and we know how good they are in a large number of patients. So indirectly we know that in a large number of patients these joint replacements have been done, and also they work well to improve their quality of life. For example, if you see this graph here, the number of joint replacements are increasing every year, and they are in fact increasing in exponential number, which again indirectly tell you that these operations are best to improve the quality of life. So the next question is, what age is the best age for a joint replacement surgery? For example, you are young, not even crossed 50, should you have a joint replacement surgery? Which is very common in the country like ours with a large population. Now, the joint replacements are ideal for old elderly patients because the joint replacement will last about 20 years on average in over 90% of patients. That is why the joint replacements are recommended for older generation only. However, you remember that if a quality of life is compromised to an extent that the patients are suffering so much because of the joint pain, the joint replacements are done in any age. For that matter, we have a joint replacements done even in their 20s and 30s and 40s. So the joint replacement, even though it's ideal for elderly population, joint replacement can be done even in younger population when their mobility has been restricted to an extent that their daily life become very difficult. For example, this young gentleman who is only 25-year-old, a software engineer, had crippling ankylosing spondylitis in his both hips. What it means is that even though he is young, energetic, educated, he cannot mobilize properly because of this crippling disease. In fact, he had this joint replacement surgery about 10 years ago, and his life is completely changed, and you can see here the way he is walking like a normal person and also involved in all kind of normal activity which is necessary for his age. Or you can see this young lady who is in her 30s. She is suffering from juvenile rheumatoid arthritis, and all kind of treatment including alternative therapies and medicines and injections and physiotherapy has been done over a period of time of like 3-4 years, which was not able to relieve her pain. And the way she is walking with limping you can see here. And she underwent a joint replacement surgery which is going to give her at least about 20 to 25 years of good knees and good life when she is active. And you can see how nicely she can walk after the surgery. Now this lady in her 40s, she is crippling rheumatoid arthritis in her both knees. She avoided operation for many years for her ignorance, and also did not get a proper advice from her relatives or by in fact her doctors. She was not even taking the medicines properly, but ended up in such a crippling both knee pain that her husband has to carry her every day to the basic needs of the daily life. And finally she got both knee replacement done, and you can see she is walking normally and she has a normal lifestyle and no pain and no painkillers since last few years after the operation now. Now the next question very commonly asked, or sometimes you have been advised, is should you delay the joint replacement surgery or should we not go and see a joint replacement surgeon early? You should understand that all these arthritis or a joint pain problems are slow diseases and they don't advance very quickly, and hence you can see your doctor at your leisure. However, don't wait too many years or too many months with lot of pain in the joints, because alternative therapies are available. You don't have to have a joint replacement for every pain. So make sure that you see a qualified orthopedic surgeon early so that you can have a plan for the pain if it get worse in the future, or surgery or medications depending on your medical condition. For example, if you see this gentleman who is a retired teacher but postponed his knee surgery for many years, and he had a crippling disease, he was not able to go to the bathroom, toilet, he had to use his walker all the time, and he couldn't sleep properly because of the pain. However, he always resisted an operation because somebody has advised him that this operation may not work. Finally, whether somebody say it will work or it will not work, these diseases which are going to get progressed will end up in this kind of problem. If you see this gentleman, he cannot walk to the basic needs, and if you see his X-ray, he has not only got a lot of wear and tear in the joint, in fact the bone below the joint is broken. You can imagine how much pain he would have been suffering with this problem. And he came to us, we did a joint replacement surgery as well as the fixation of that crack in the bone with a rod which is joined to the joint replacement surgery. And you can imagine that his mobility restored back to normal and how happy he could be. Another commonly asked question is, how many years this joint replacement will last? On average, most of the joint replacements will last about 20 years. There are a lot of studies which have been conducted in millions of people to study how many years they really work for. For example, this lady who resisted or was not ready for a joint replacement surgery for over 2 decades underwent a joint replacement surgery by me about 10 years ago. Now she has come back to us with her own son who is now 60 and wanting for a joint replacement surgery. In fact, he had a joint replacement surgery 3 months ago in our hospital. So what you can understand here is the joint replacement functions so well for so many years, plus it works so satisfactorily that a mother will bring her own son for a joint replacement surgery later on. Next questions asked is will I be bedridden after the joint replacement surgery? How long is the bed rest after the operation? People start walking very early. Within 1 day, most of the patients start walking, and they start going to the bathroom, toilet within 1 or 2 days. And when they go home, they are self-sufficient in the sense, they can do their basic activities themselves. In this example, if you see, 78-year-old, a retired anesthetic doctor himself underwent both knee replacements. And you can see he's walking in the hospital comfortably with the help of the walker. And when he was left home, he is independent to the bathroom and toilet. And in the next picture, you can see lady who had a joint replacement surgery a week ago is able to climb stairs to the bathroom and toilet and her basic needs in her home. And you can see the next picture where the professor of the anesthesia is already out in the garden within 3 weeks after the surgery. Everybody is worried about the operation, and people may think that after operation my sports or my active career as a person is stopped because of the joint replacement surgery, which is not true. In fact, most of the patients who have joint replacement surgery do all activities including the sports which is suitable for their age. For example, this lady who is on a travel for a long distance sent me this photograph from Jungfrau, which is the highest peak of Alps in the Europe, when she was visiting Switzerland. Or you can see the lady in the next picture who crossed the Nathula Pass as a part of the family holiday. So people do all kind of normal recreational activity, whatever is needed for their age. Now, a lot of people are worried before they see the doctor. If you go to the doctor, it may be only joint replacement. He may advise only the operation, which is not true. Only about 2 to 3% of the patients with joint pain will require operation. Remaining over 90% of the people can have a non-operative treatment, which includes exercises, lifestyle modifications, physiotherapy and medications. So don't get worried. However, one thing very important to understand is there is a difference between managing these problems and curing these problems. You can manage them with medications and also with other methods which I have just described it to you. However, lot of these arthritis are not curable. That is why when there is a severe pain, when there is an end stage disease, you will have to have a joint replacement surgery to cure the problem. So you can be managed if the pain is not so bad, whereas if you have impossible pain, it may be better to have a joint replacement surgery to improve the quality of life. When a joint replacement surgery has been described to some patient, or when the joint replacement surgery has been advised to them, we naturally try to find an easy answer, or most likely a non-operative option. Remember that there may be a lot of options, but what is important you to make a decision is that those options, are they scientific, or are they really going to help you, or rather just waste your time. Remember important point that lot of medicines, alternative medicines, the chemicals, the massages and the radiotherapies and lot of kind of therapies have been unnecessarily advertised, and they are available on the public domain. Remember, the cartilage which is worn out has not come back for anybody so far in the history of the medicine. That is why it's important to understand that lot of those medicines which has been advertised are absolutely no use in curing these diseases, and be careful not to become victim of some of these medicines which have contaminated with dangerous substances, or sometimes they can cause some issue with the general health of your body. And if you see these patients, all three had some kind of oil. Some of them are herbal oils rubbed on their knee, causing blebs, allergies and wounds. And some of these one also have substances like steroids in those medicines, and hence be careful in using any alternate kind of medicine on the joints. It's also important that you don't eat a lot of painkillers, because the painkillers can make your pain temporarily better, but they don't cure the cartilage inside. Painkillers can be helpful to avoid operation in those patients who have only mild disease. However, if you have to take a lot of painkillers, they can cause you side effect, and hence it's important that you consult a qualified and orthopedic surgeon to guide you with these kind of decisions. You may have doubt that the success of these joint replacement surgeries are low. It is not true. The joint replacement surgeries are one of the best operations with the least complications among all operations in the described medical textbooks. In fact, the hip replacement was once described as the operation of the century, because statistically these joints are very highly successful, one thing, and second thing, the quality of life which improves after these kind of operations like joint replacements in the hip or a knee or other joints are much superior compared to all other operations which is done commonly. A lot of people have doubt that after the joint replacement surgery you cannot bend your knee. It is not true. People have normal knee function after joint replacement surgery. People can bend from 0 to about 120 degrees, which is good enough for all normal activities after joint replacement surgery. Because of lot of pressure of sitting on the floor cross-legged, we tell lot of patients not to do that on a routine basis. However, some patients for their cultural needs or for their work do sit on the floor. For example, if you see this patient, she is a Hindustani musician and she sits on the floor whenever she is performing her music. Whereas the other person who don't have to sit on the floor, but for a cultural reason, you can see he can comfortably sit on the floor, and which we usually tell most of the patients to avoid unnecessarily so that the joint should last many years. So the joint replacement patients have a normal knee function. They can bend their knee, and in fact some of them can sit on the floor if necessary. However, to avoid complications on the knee, we tell these patients not to sit on the floor on a routine basis. A lot of patients have doubt that if the joint replacement fails for any reason, what will happen to me? You can see there are a lot of prescribed protocols for all these problems. If the patient has infection or any other failure of the joint, they can have a revision joint replacement done. These revision joint replacements are rare, but in the modern technology, these joint replacements, including the revisions, are becoming more and more successful. For example, if you see this doctor himself, He is a physician in his 70s, had one of the joint got infected, and this was successfully revised with a long stem revision joint replacement surgery. In fact, the popularity of the joint replacement surgery is so much that these are all the doctors, in fact, who had the joint replacement surgery under my care. Next question is, do we have any problem if we replace both the knee joints together? You can understand doing both joints together is a double job, and hence it will be more difficult naturally than doing a one joint replacement. At the same time, by doing both knee joints together, we can improve people's mobility quickly, especially if they have a lot of pain in the both joints, and hence there are standard strict protocols when we do both joint replacements. For example, somebody who is healthy, who is less than 70-year-old, who has no comorbidities like heart, BP and other medical problems, they can have both joint replacements successfully, even though having both joints together is not compulsory. For example, if somebody would like to have only one knee and come back and have another knee replacement later is also okay. What about the activities of daily life after the joint replacement surgery? People can do all normal activities, whatever is required for their age. For example, people can easily drive, people can easily ride their bike or cycle, people can swim and also actively participate in their normal sports and the lighter sports, for example, for elderly people without any problem after the joint replacement surgery. These joint replacements are done from the metals, which are medical grade metals which have been tested in so many people over the years now. Common question asked is, do they get rejected by the body because they are foreign materials? No, they don't get rejected because these metals, they don't have immunity. Unless they have immune cells on the body, these metals or any foreign objects cannot cause an immune related rejection. These are all inert metals, one thing. And second thing is, they have been tested in so many people that they work without any problem. And hence there is no issue of rejection with these joint replacement prostheses. A lot of people are really afraid of the physiotherapy which has to be done after the joint replacement. This was the case in the earlier years. However, now because of the advances in the joint replacement surgery and the technique, the role of physiotherapy has become very, very minimal. You do get physiotherapists to work on your knee for first 4 days when you are in the hospital. After that, if you are able to perform your exercises yourself, you can go home and do your exercises on your own without the help of any other medical person. However, the physiotherapy should not be done by forcing the knee too much and bending the knee too much, causing too much of pain. The knee gets better day by day with little minor exercises only without any vigorous physiotherapy. And hence the role of physiotherapy is not much, and so you don't have to worry about the pain during the physiotherapy after the surgery. People who have diabetes, hypertension or heart related ailment, can they have joint replacement surgery? Yes, all these patients will undergo something called as a pre-operative medical checkup. A specialist with interest and specialization in heart surgery, cardiology, anesthesia, internal medicine will check them, and they advise what exactly to be done before the surgery. Almost all these patients who have medical comorbidities can be nicely optimized before surgery, and almost all of them can have a safe joint replacement surgery. Obese patients, can they have a joint replacement surgery? This is a difficult question because the patients who are obese have more problem in their knee because of the wear and tear and also because of the pressure on both the knees while walking. However, unless the knee is better, they cannot walk properly, they cannot exercise properly, and they cannot reduce their weight as well. So it becomes a difficult vicious circle. So the pain is more, the weight is more. Even though some of these patients have bariatric surgery, they fail to reduce their weight because the knee pain will not allow them to mobilize properly, walk properly and exercise properly. And hence it's been shown now all over the world that the obese patients also have equally good results after the joint replacement surgery. So there is no need that the patients who are obese avoid these operations when they cannot walk or do good exercises to reduce their weight. For example, this is the mother of a gastroenterologist who underwent a joint replacement surgery on one knee. Within few months, she was so satisfied that she came back and got the other knee joint replacements as well. So some patients may have a query that what will happen if I avoid the joint replacement forever? Obviously, the joint replacement is not like the heart or a cancer or a brain condition. You can avoid these operations, but make sure that your mobility is not compromised, because in older age that mobility is very important. Only little exercise what you can do with little walk, that also will become difficult. In fact, some of the patients have a lot of problems because they are not able to mobilize. For example, if you see this lady who have been misguided by someone that you should not have a joint replacement, she was unable to do any activities at home. In fact, she used to say to me that she was so crippled that she couldn't do her basic activity. One day while in the toilet, because of her knee problem, she fell and broke her hip as well. So now you have an elderly lady who has a broken hip, cannot walk, and her both knees are completely destroyed by arthritis. And we had to put a rod in the thigh bone, and we had to replace her both knee joints to make her mobile. Now it is about 6 or 7 years after the surgery. In fact, there are about 6 or 7 of her own relatives saw her and came back and got a knee replacement done by me. It is such a gratifying feeling when these patients walk so well and mobilize and also help in their community to spread that the good thing about the joint replacement surgery. Next question is these patients have a lot of pain during and after operation? Absolutely no pain during the operation because of the modern anesthesia. And after surgery, all these patients will have some kind of anesthesia blocks or an epidural anesthesia. What it means is that some technique of anesthesia will continue to treat them even after the surgery for a couple of days. And because of these modern anesthesia and block techniques, patients will not have much pain in the period after the operation also. After going home, we will be supplementing these patients with some kind of pain relief. However, considering an operation, some pain is expected until about 4 to 6 weeks time after this operation. So when you have decided to have a joint replacement surgery, a lot of patients do have a doubt that which type of joint replacement I should have. Is there a better quality joint or a lesser quality joint? Which metal is better, which is not better? Now, these are very technical things about the joint replacement surgery, and for an individual patient it may be very difficult. But remember one important point. The joint replacement surgery which is used in anybody should have a long-term follow-up. It should have been shown that this particular design of joint replacement has been used in lot of people successfully over a period of at least 10 years, ideally up to 20 years, with success rate of over 90%. And hence, it's important that we don't just go behind some fancy stuff or something which is costly. It's important that we go behind with the science, we go behind which has been proven to be the best, in terms of statistics and in terms of the long follow-up. A lot of patients have questions on the techniques of the joint replacement surgery. There are some modern techniques, some of them are mini invasive techniques, some of them are mini incision techniques, robotics, navigation stuff, and also so many other techniques have been described in the literature. So many techniques have also been used or sometimes misused in the public media. What you have to understand here is none of these techniques, for example, the computer navigation, robotics, mini incision, or minimally invasive surgeries have conclusively never have shown that they are better than the standard joint replacement surgeries. Most of them have been used in specific situations only, and most of them have been used in those specific conditions to help the surgeon. However, you don't have to worry about what type of technique, what type of instrument, what type of the navigation or an advanced technique has been used in your knee. Most of the knee replacements performed across the world with the standard techniques have been good, and they have been shown to be consistently good results over last 30 to 40 years now. Some patients, other than having a lot of pain in the knee joint or hip joint, you can see they have also pain in the elbow joints and shoulder. We have shoulder replacement also, and also elbow replacements, which is commonly done in this country. The shoulder replacement, for example, if you see, this patient has previous injury, a fracture, a metal fixation which was removed, but later on we had to do a shoulder replacement surgery. You can see that before the surgery he was not even able to lift his arm up. Just after the 2 weeks he can lift over the shoulder without pain. Shoulder replacements are becoming very popular in some of the conditions in the shoulder. Similarly, elbow replacements are also available. This lady who is suffering from rheumatoid arthritis since many years had very bad elbow. You can see her before operation and after operation with the fantastic results about 8 years now after the operation. Some patients may be very young when they have joint pain. As I was mentioning to you earlier, the joint replacements will not last their life, and it may be about 20 years in over 90% of patients. What can be done for these patients when they are young but they have a lot of pain in the joint? So as an interim procedure, some of these patients can have something called as a partial joint replacement. If you see, this gentleman has only arthritis in the half of the knee joint and he is young. We did a procedure called as a partial knee replacement. You can see the quality of life of this patient, which is completely normal. He can walk normally, sit on the floor, and involve in all kind of activities needed for his age. And hence the partial knee replacements are becoming popular in that age group. Lastly, do we have any problems with the joint replacement surgeries? Do we have complications? Yes, all the surgical procedures do have some complications in a small number of patients. For example, about 0.1 to 0.5% of patients can have infection in the knee joint, which may require further treatment. Some patients can have clots developing in the calf, which can go to the lungs and heart, called pulmonary embolism, but that happens very rarely, to an extent that 1 in 1,000. Because of these problems, all these operations are done in very, very sophisticated centers with all kind of facilities available. All these problems are better prevented than treating them later. And hence it's important that every precaution is taken, both medically and physically, and also from the patient and by the family, when we are having these kind of important and technically sophisticated operations on their body. To summarize, joint replacement surgeries are the real boon to the patients who are suffering from severe joint pain. They have been done in millions of people in the last 50 years or so. And hence, don't get worried if you have to have a joint replacement surgery, because they are safe, effective, and they improve the quality of life better than any other operations. We have also published a book on the joint replacement surgery for the public to understand the principles, the complications, and decision making. Have a good read of the book, and also we wish you